Happy Wednesday. It's Hump Day, March 19th, 2014. Dr. Peter Glidden here, coming at you live, your steadfast advocate for health. Wishing you and yours healthy, wealthy, and wise life. Remember, longevity has the potential to make you healthy and wealthy. You're going to have to figure out the wise thing on your own, however. So what do we do here? We talk about science-based, clinically verified alternatives to drugs and surgery every day. Therapeutics, which, by the way, were developed and delivered by licensed and regulated naturopathic physicians. This is not some internet sensation. This is not some holistic health fad. This is science-based, clinically verified alternatives to drugs and surgery. And we bring this information to the marketplace because the MDs don't know what's best for you. They only know what they've been trained in, and what they've been trained in is just one small piece of the pie of medical science. It's referred to as allopathic reductionism, and it's horrible in the treatment of chronic disease. It is horrible in the treatment of chronic disease. Give you a perfect example. Spoke to a person today and actually an old patient of mine from back in the day when I had a private practice full-time. And her story was not a good one. She had developed restless legs at night in bed to the point where she couldn't sleep soundly. She had to get up and walk around, and she couldn't sleep. Can't sleep. She has to get up 2-3 times a night to walk around. She's got pain, neurological pain, neuropathy. As a result, has to continually move her arms and her legs. Gets worse at night. Also experiencing musculoskeletal pain in her mid-back that she can't get on the other side of. Also has chronic gastritis, which she can't get on the other side of. And went to the MDs. And the MDs did a stomach operation, which was completely ineffective. She still has the gastritis. They gave her morphine, and they gave her gabapentin in order to help to manage the pain. She's going straight to you-know-where in a handbasket, and she's suffering needlessly. All the while having access to what is supposed to be the best medical treatment in the world, right? Conventional American medicine. Isn't that supposed to be the best? Isn't that supposed to be the best it gets? Well, it's not. And this, her experience of her body-mind is a perfect example. Oh, by the way, all of her symptoms started after she became pregnant. All of her symptoms started after she became pregnant. Now, that's very interesting. She thought it was maybe from, it's a neurological thing, right? It's at least that's what she assumes it is. It's nerves that are having a problem. And she assumes that, well, maybe they nicked something when they gave her the epidural for her birth. But it's absolutely positively the wrong way to think about it. The fact of the matter is that all of these conditions, muscle spasms, restless legs, restless limbs, gastritis, chronic musculoskeletal pain in the mid-back, these are all different arms of the same octopus. And the octopus in this case is chronic undiagnosed calcium and magnesium deficiencies. Chronic undiagnosed calcium and magnesium deficiencies. And this is a problem. It's a big problem because she doesn't know it. It's a bigger problem because her MDs don't know it. And she's suffering needlessly because of lack of knowledge, lack of information. It's really quite simple when you dial it in from the proper perspective, from the right perspective, everything makes sense, right? From the proper perspective, everything makes sense. But her MDs don't have the proper perspective, not because they're stupid, but because they're trained in an ineffective methodology. They're trained in a way of looking at human health, at looking how the human body works, that's inconsistent with reality. And remember, MDs aren't really doctors anymore. They're just drug salesmen who know how to diagnose illnesses and who have a medical license. They're pharmacists who've been taught how to diagnose illness. And even when it comes to diagnoses, they do that quite poorly, in my opinion. But in any event, so, right, she goes to the MD. She's got all these conditions. By the way, she's been struggling with these conditions for the last 3 years, ever since the birth of her child. She's getting progressively worse, so what do they have her on? Morphine. Now they've got her on morphine. Unbelievable. Is the morphine fixing the problem? Nope. It's not fixing the problem, it's managing the problem, and it's doing that poorly because she still has symptoms. Now, interesting, right? From our point of view, gastritis is caused by a lack of calcium. Well, what lack of calcium in the body? If you don't have enough calcium in the body, your stomach acid is too weak. If your stomach acid is too weak, then a chemical in the stomach builds up called gastrin. Gastrin builds up in the absence of strong stomach acid. When gastrin builds up to an excessive amount, there's a little flap on the top of the stomach that opens up, because that's what gastrin does. It opens that flap up when it gets to a certain concentration. And then the contents of the stomach squirt back up into the throat. The throat has no protective lining, and so you get chronic irritation of the esophagus, and there are variations on this theme, right? Gastritis, heartburn, gastroesophageal reflux disease, and Barrett's esophagus, right? It's the same illness, just different iterations of it, different intensities of the same illness. This is caused by two things: lack of calcium and lack of salt. By the way, her MDs recommended that she be on a salt-restricted diet, and so for the last 10 years of her life, she's been on a salt-restricted diet. Absolutely positively the reverse of what she should have done. Absolutely positively the wrong thing for her to do. Absolutely positively the exact opposite of what she should do in order to make herself healthy. But she trusts that the MDs know what's what, and she got it wrong. She bet on the wrong horse. Now, so that's one thing, right? That explains the gastritis. She doesn't have any calcium in her body, and she's salt deficient. So she needs to bump those two things up, number one. Number two, the single most common cause of restless legs at night in bed, restless extremities at night in bed, kind of this sort of internal anxiety that you feel in your muscles, and you gotta move, you just gotta move. It's like you got ants under your skin, you just gotta move, you're provoked to move, you can't sit still, I just gotta. You know what causes that? Not enough calcium and not enough magnesium, period. That's what causes that. So that's strike two against chronic, undiagnosed, undetected calcium deficiencies. Strike two. Third symptom was chronic pain in the back, chronic pain in the mid-back. She's had chiropractic adjustments, helped a little bit, but the symptom always came back. She's been to pain specialists. She's been everywhere. She's had physical therapy. She's done acupuncture. Didn't help. A little bit, but then the symptoms came back. What causes chronic pain in the back? Well, let's see what type of tissues are in the back. We've got muscles, we've got ligaments, we've got tendons, and we've got bones. What do muscles, ligaments, tendons, and bones all need in order to be healthy? Calcium, plus the 90 essential nutrients. So, essential nutrients are called essential because you can't live without them, and they need to be imported into the body every day. Interesting to understand that cholesterol is not an essential nutrient because your body can make it. Cholesterol is extremely important for your health, but it's not considered essential because your body can make it. Well, your body can't make calcium. A cow's body can't make calcium. Plants can't make calcium or any of the other 90 essential nutrients. The 90 essential nutrients need to be imported into the body every day. That's what determines whether a nutrient is essential. An essential nutrient is something that you need, you can't make, and you'll get sick if you don't have it. You need it, you can't make it, and you'll get sick if you don't have it. We've all known about rickets, right? Rickets is a vitamin D like David deficiency. Scurvy, the old pirate disease, scurvy me matey, Well, that's a vitamin C like Charlie deficiency, right? Well, as it turns out, there's thousands of nutrient deficiency diseases, but your MD has no training, no experience, no appreciation, no respect for this methodology. And they're closed-minded conventionalists who have intellectual cowardice, and they're not going to question their inept failed therapeutics. They're just going to let the patient suffer while they collect a paycheck and go home. Right? It's got to be in her head. That's what it's got to be in her head. She's a psych case. No, she's not. You're a bad doctor. She's an excellent person. You're a bad doctor. So, the most common cause of chronic musculoskeletal consistent pain is lack of bone, ligament, tendon, and muscle nutrients. And, there are 90 essential nutrients that are required there, but the three biggest players are calcium and magnesium. You knew I was going to say that, right? calcium, magnesium, and selenium. So, and sulfur-bearing molecules, chondroitin sulfate, glucosamine sulfate. So this woman's in the weeds. Things are getting worse and worse instead of better and better. And remember, it all happened when she got pregnant. Now, what's the relationship to that? Was it the epidural? No. So, her body needs a full nutritional tank every day. Your body needs a full nutritional tank every day. My body needs a full nutritional tank every day. We can't get the 90 essential nutrients from food. They're not there. It's impossible to secure them just from eating well. You can't do it. So everybody's nutritionally deficient. She's nutritionally deficient. Guess what? So, I'm making numbers up here, but based on her symptomology, I would hazard a guess to say that when she was pregnant, her nutritional tank was maybe 30% full. And then the child developing in her body robs as many nutrients as it can. So now after the child is born, guess what? She's got maybe 10% of her nutrient tank, if that, full, and everything starts to fall apart after she gets pregnant and gives birth. Luckily, the child wasn't born with birth defects, but the child has been struggling with attention deficit disorder for 3 years. Now, why do you think that is? Because the child was developing in a uterus that was completely undernutrified all of the time. And medical doctors don't know this. What do? They throw morphine at it. And, they're giving psychoactive drugs to a 3-year-old kid because they have ADD. And you've got to be kidding me. When will the insanity end? Well, I'm not exactly sure when the insanity will end. I'd like to think that it will end right about now by you tuning in and listening to this program. Because what this woman needs, what her child needs, what her husband needs, what her brothers and sisters and family members need are the 90 essential nutrients. She needs the 90 essential nutrients every day, plus, in her case, extra calcium. She needs to salt her food, and guess what? It's all going to go away. It's all going to just disappear. And that's how we roll, and that's why everybody in the world needs to know what we do. Fire your medical doctor now, ladies and gentlemen, not because they're a bad person, but because they've got nothing for you. Go into the phones when we come back. Stick around. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health, welcoming you to another live edition of Fire Your MD Now. The phones are all lit up, so let's get right to it, shall we? Let's go to George in Oregon. Hey, George, thanks for the phone call. You are live.
Hello, Dr. Glidden. I'm calling in today. We talked last week about my son with the medial patella-femoral ligament that had been detached from the patella.
Yeah. So did you find out whether it was completely detached or just a little bit?
It was completely detached, and they said not to wait very long on the surgery when it's completely detached because they want to get it back to the bone as soon as possible so it has less chance to heal.
Okay, great. So, that's the distinction that we needed to make here, right? Because when it's completely detached, you need surgery to get it back on. But, once you get it back on, the bone needs nutrition in order to strengthen that. And quite frankly, we could make the argument that the reason that it popped in the first place was a combination of two things, the physical stress and a weak joint. And what caused the joint to be weak? Well, lack of nutrition for his whole life, right?
Right.
Yeah.
So we had the surgery yesterday morning.
Yeah.
He's in a leg cast from his thigh all the way to his ankle right now. The doctor was concerned because of him taking supplements because of the anti-inflammatory effect, and they want as much inflammation as possible so that the ligament will take to the bone. So I'm wondering if any of the supplements that you gave me have too much of an anti-inflammatory effect. And the reason he said this is because of a study they did on rotator cuffs, where 50% of the people who got the rotator cuff tear repaired, it didn't take because of they were taking anti-inflammatories. In that case, specifically ibuprofen, which I understand is entirely different from our medical nutrition.
Yeah. So that's an interesting thing to talk about, right? So the answer is no, there's no worries, there's no harm, and there's no foul here. And, inside the mind of the MD, they don't have any understanding of the positive effects of science-based, clinically verified medical nutrition developed and delivered by licensed physicians. It's completely outside of their wheelhouse. They don't have any understanding of it whatsoever. And, notwithstanding that, there's a great deal of difference between the anti-inflammatory effects of a synthetic man-made drug, concentrated and what's the word I'm looking for? It's concentrated and standardized to a specific milligram dose that produces a big effect. I mean, that's why they do it, right? There's a big difference between that and the anti-inflammatory effects of an herb or a vitamin supplement or an essential fatty acid. It's kind of like comparing a tabby cat to a mountain lion. Well, they're both cats. And, they're both natural-born killers, right? But there's a great deal of difference between the damage that a tabby cat and a mountain lion can do. So it's a good question, and I'm glad that you called me back and asked it. But really, it speaks to the misunderstanding that the medical professional brings to bear in the treatment of people when it comes to medical nutrition. Really, what he should have said is, I have no idea, you need to consult a medical professional who has clinical experience with this. That's what they should have said. But they never say that, which is interesting to me. There's no harm and no foul here. Give them the supplements and, Katie bar the door.
Okay, I wanted to add one more thing. I added to your supplement list the fucoidan because of the stem cell effect. Is that maybe not such a good idea, or?
No, that's an excellent idea. The fucoidan is an excellent thing to do. There have been over 1,100 published studies on the positive effects of fucoidan. And, whenever we're trying to help the body fix tissue, then fucoidan is an excellent idea. And by the way, the action of fucoidan is not anti-inflammatory. So there's no harm and no foul there, man. I would just go for it. And listen, here's what I'd like you to do, though, just to kind of keep everything in perspective. Get from the surgeon, he's probably already given it to you, a timetable inside of which he expects, your son to recover from this. 8 weeks, 12 weeks, whatever.
8 weeks until they expect the spanks in the bone. I think they call it the spank cell or whatever it is in the bone. I can't remember if that's what it's actually called.
All right, so when you go back for the appropriate follow-up, you want to make sure you ask this guy, relative to everybody else, how'd my son do? Is he ahead of the curve? Is he, worse off than you thought he would be? Is he 10 times better than you thought he'd be at this point in time, 100 times better, whatever? Because that will help you to understand, what we're about here. Because what we lean on, what we rely on, our entire strength here is results. So you want to look to see what type of specific and measurable and noticeable results the program generates, and that's a beautiful thing. Good luck, man. Thanks for the call. Stick around, folks. More to come. Welcome back, everybody. Dr. Peter Glidden here, Wednesday, March 19th, 2014. If you're watching the live stream, check it out. Let us know what you think. We're dabbling with new technology every day, hoping to make your experience better, because when it's better, it's more fun. When it's more fun, it's more friendly. When it's more friendly, everybody piles on the bus. And that's exactly what we are attempting to do here, get as many people as we can to pile on the bus of Fire Your MD Now. And remember, our message is not fire your blankety-blank MD now because he's an SOB, no good human being. It's not that. That's not the message. The message is fire your MD now because the therapeutics that they're trained in are juvenile, old-fashioned, outdated, ineffective, expensive, and completely are out of sync with what it really means to be a human being, which is a long-winded way of saying MD-directed, pharmaceutical-centrist, allopathic, reductionistic medical treatments for chronic disease don't work. They don't work. So why on earth would you avail yourself of their services? So we say fire them because they're no good at what they do when it comes to chronic disease. It's just a fact. Like Walter Brennan used to say, just the facts, ma'am, just the facts. Canada's up next. Sandra is here. Hey, Sandra, thanks for the phone call. You are live.
Hi, Dr. Glidden.
What's going on, Sandra? Thanks for the phone call.
Thank you so much for what you're doing and giving us hope that there is a better way.
You're welcome.
Dr. Glidden, I'm calling because regarding my mom, she's scheduled to do surgery to remove her thyroid.
Yikes.
And she has removed one side about 30 years ago, and now she's scheduled to remove the other side. What's been happening is that she has some nodules, and the thyroid, I think, itself has grown from 2-point-something to 3-point-something within a few months. She has gone for a couple of biopsies, but they couldn't get enough liquid to determine if it's cancerous or not. But then they told us that 90% it's nothing, but there is that 10% chance.
So they basically have no idea what they're talking about, and they're the only thing that they're able to offer you is basically fear. Well, there's a 10% chance that it's cancerous. There's a 90% chance that it's not, so we're going to remove the whole thing anyway. Yeah. And this is just, this is a perfect example of the way that the MD is trained to think. Because I don't know if you're a science fiction fan, but I am. And I'm a big Trekkie. I'm a big Star Trek guy. And there was a whole series of Star Trek episodes where they were battling this race that was half person, half machine. And this is what the MD in a perfect world would turn everybody into, right? You don't need your thyroid. You don't need your tonsils. You don't need your adenoids. You don't need your stomach. You don't need your appendix. You don't need your gallbladder. You might as well, get fake knees now and prevent, a bad surgical outcome when you're less healthy than you are now. Let's just take care of it all when you're young. Let's give everybody titanium knees, titanium hips. Let's give everybody a fake heart. Let's remove one kidney. Let's cut our breasts off. I mean, for goodness sake, when will it end? Yeah. This is just the way that they think. And sometimes, look, right, we got to keep it all in perspective. Sometimes it's appropriate. Surgery is necessary and appropriate, and it'll save your life. And it's awesome. And sometimes it's ridiculous and dangerous and a silly thing to do, and the only reason that it's recommended is because it's the only thing they've got in their tool belt. Like the fella said, when all you have is a hammer, everything looks like a nail, and, often this is the case. Now, you can never unsurgery something. You can never unsurgery something. So if it were me, and, there was a 90% chance that I was going to be okay, then I would avoid the surgery completely. I wouldn't have the surgery. And everybody's overlooking a pretty important fact here. She had a thyroid problem 30 years ago. They removed it. That was their solution. Apparently, it wasn't an effective solution because now the trouble is back. Right? Now those chickens have come back home to roost. So what does that mean? She's got the bad thyroid gene? She's got a voodoo curse? No. What it means is the MD, because of their methodology, because of their philosophy, because of their training, have completely no idea whatsoever as to how to make her thyroid healthy. They have no idea how to do that. So their methodology is, well, it's starting to get problematic. Let's just cut it the hell out. Just cut it out. Because that's how they think. So if it were me, I would get on an aggressive program to support and promote the structure and function of the thyroid gland. That's what I would do. I mean, 90% chance it's not cancer. I'm good with that. I'm good with that. I'd rather have half of a healthy thyroid than none of a healthy thyroid. So thank you very much. And, she didn't get a problem with her thyroid because she had a surgery deficiency, right?
That's right.
Yeah, that's right, exactly. So, from our point of view, there's a number of things that happen to make an organ start malfunctioning, or in this case, a gland start malfunctioning. So what is that? Well, it's consistent consumption of all the wrong food, and egregious lack of nutrition. It's kind of like you eat food that causes a little fire in the thyroid, but then the fire department in your body doesn't have the ability to put the fire out because it doesn't have any water. Well, not water in this case, but it doesn't have the stuff it needs to put the fire out. Yeah. Right? So, if it were me, what I would do for 6 months is I would do an aggressive support the thyroid program, and then I'd have it reassessed 6 months from now.
Okay. But one thing that I want to ask is that what if, God forbid, it is cancerous and we about it until 6 months. What's going to happen? Is it going to spread?
Well, you need to, all right, it's a great question, and it's an appropriate question. What you need to do is ask the oncologist that question, or ask the doctor that question, because that's their wheelhouse. It's the MD's job to know what type of cancers can show up in different parts of the body. Right? There's a difference between thyroid cancer and lung cancer and heart cancer and pancreatic cancer and skin cancer. There's a difference. And some cancers spread like wildfire easily. Some cancers don't at all.
That's the thing. I asked, actually, this question, and they say that it doesn't spread that quickly. But how long do we have? You know what I mean?
Well, I mean, that's the question that they need to answer. And it's a little bit, the situation here, again, is, let's say that there is a cancerous thing at play. Okay. Well, why does she have cancer? Because she has a thyroid? No. But she doesn't have cancer because she has a thyroid. She gets cancer because there's a weakness, a systemic across-the-board weakness in the body, and a constant stress to the body that's hammering the thyroid. And if it's hammering the thyroid, it's hammering other parts of the body as well. So simply removing the thyroid and then washing your hands and going about your business is kind of juvenile, because if there is a carcinogenic process at play in the background of her body, it's going to come out somewhere else eventually. So she needs to get on board the medical nutrition program either way. She needs to get on board the medical nutrition program either way. And you know what it sounds like to me that would be an appropriate thing for you to do right now? I believe that the best thing for you to do right now is to get a second opinion. I think you need to go to a different doctor, maybe go to a thyroid cancer specialist, and you need to say, look, this is what these people did for biopsy, and they're telling me it's a 90-10 percentage, and I need to know better than that. Is there anything else that you can do as a thyroid specialist that can help me know for sure whether this is carcinogenic or not? Because I need to know. And also I want you to line up for me what are the types of thyroid cancer and what's the heck's going to happen to me if it is cancer and I don't remove the thyroid right now. You need a second opinion. You need more data.
Okay.
Sounds to me like the people that you're going to now are, they're just a little lazy or something.
Well, we have gone to 2 different specialists, and they both suggested that it's better to take it out. This way you're safe.
I know that that's what they would say because they're all in the same club. But the question that needs to be asked is, why weren't you able to diagnose it? Is there some place else in the country that I can go that where they're competent so that they can diagnose it? And what are I want numbers. I want to know numbers. I want to know my statistical chances here. I want to know what type of thyroid cancer it could be. I want to know how invasive it could be. I want to know what the chances of it spreading are specifically. Is it a 10%? Is it 25%? Is it 72.7%? They know what the numbers are. But see, from their point of view, they're thinking about this, holy smokes, I wish the patient would just shut up and do what we tell them. I wish the patient would just shut up and do what we tell them, because what the heck, it might be thyroid cancer. Well, you could say that for anybody. Anybody might get thyroid cancer, so let's just cut the thyroid out. That's what Angelina Jolie did. She cut her breasts off, right?
Yeah.
She cut her breasts off preventively. Well, is that a good idea? I don't think so. But every MD in the world has got behind that and said, that's the best thing that's ever happened. So it's a complicated situation. You need more specific information. And really, you need to hold their feet to the fire as to why they were not able to diagnose this appropriately. Again, if it were me, okay, there's no way I would have that surgery and I would do this. I would do an aggressive thyroid support program, and I would continue to monitor it. But see, the problem here is they can't monitor it because they screwed the diagnosis up. They weren't able to diagnose it. They weren't able to tell you definitively, you got cancer, no, you don't.
Well, what they're saying is that because with the biopsy, what happened is that they say it has gotten so hard, it's like the shell of the egg, and the needle doesn't go through properly for them to get what they need.
So you want to ask them, with a tumor that has a hard shell like that, what are the statistical chances of it being cancer and spreading?
Okay.
Now, the way that I've been trained to think about things like this is the harder the encasement is around any type of growth in the body, the safer you are.
Oh, okay. So that's good.
Right? Now, there was a study done a number of years ago that when women who would have mammograms and they see a little lump, and then they go in and they get a needle biopsy, the biopsy procedure itself, by piercing the tumor capsule, helped to spread the tumor.
Oh.
Because the body was walling it off. And the needle biopsy actually broke the defensive wall that the body had built around the tumor, opened up a little window, blood got in there, and then the cancer cells spread. So, it's one gigantic problem where people are, they're chasing their tails. They don't really know. You got to ask them hard questions. This is why you need an advocate, like a patient's advocate. And I'm glad that you called. So if it were me, I would call them back and I would say, look, you haven't been able to tell me whether this is cancer or not, but you know that there's a hard encapsulated growth here. What are the chances of hard encapsulated growth being carcinogenic? I need to know, and that's the best I can do for you now. Well, again, if it were me, I would do an aggressive thyroid support program, and I would avoid surgery like the plague. I appreciate your call. Best
Thank you.
luck. First hour here on Wednesday, the 19th day of March, 2014. Thanks for tuning in and turning on. Phones are hooked up today. Chris in Idaho's got a cough. Hey, Chris, thanks for the call. You are live.
Hi, Doc.
What's going on, Chris?
Well, I've had a cough for about a week. It's still producing a lot of phlegm. And I was wondering if there was something I needed to do in addition to my, beyond, my 90. And the second question I have is, a friend of mine is, as far as the good food list goes, it says fruits and vegetables. I'm wondering if another product called Juice Plus would be a complement to that, or for that purpose.
Yeah, it's a good question. I'll answer the last question first. Now, Juice Plus is irrelevant because the stuff that's in Juice Plus is in the Beyond Tangy Tangerine 2.0. Yeah, I mean, it's got 115 to 112 concentrated fruits and vegetables. That's one of the secrets of the Beyond Tangy Tangerine 2.0. Remember Dr. Wallach, right? He's been around the block. And he changes and upgrades and optimizes the nutritional supplements all the time. So the Beyond Tangy Tangerine 2.0 has all of the bang that Juice Plus has, plus so much more. So it would be redundant and irrelevant to do that. He doesn't need to do that. Okay, so now the cough thing, that's interesting. Cough, of course, it's a lung situation, and is it an infectious thing? Is there something going around the house or going around the town? Have other people come down with it?
Yeah, the kids got it first, then I got it, and I think my wife might be getting it.
I know. Well, it's that season. When the seasons even start to, like, there's an inkling that things are going to change. First day of spring tomorrow, by the way. What's up with that? Still have snow here on the ground, right? I mean, but things are changing, and when the seasons change, we tend to get a little thrown off balance, and then we leave ourselves open to stuff like this. One of the things I would encourage you to do as a family, and you might want to tell your neighbors about this also, and other parents that have kids at school, get a bottle or two of the PureWorks foaming cleanser, and have the kids put it on their hands before they, so when they come home from school, the first thing they do is put the PureWorks foaming cleanser on their hands. First thing that they do. Make them come in through the garage and put a big bottle of it out on the table next to the garage door, right? So that they put that stuff on their hands, because that way you'll significantly knock down the vector of disease transmission. It's like mostly, hands and fingers that stuff gets passed around. So that's a really excellent thing to do at this time of the year for everybody that's got kids in school. So you need immune support help. And what do we do to support and promote the structure and function of your immune system? Well, that's easy. The killer biotic. So if it were me, well, how much do you weigh?
250.
250? All right. So for 7 days, I would do 1, 2, 3. I would do 3 killer biotic 4 times a day. I do 3 killer biotic 4 times a day for 7 days. Plus double the amount of essential fatty acids that you're taking, because essential fatty acids are extremely important for lung health. Essential fatty acids are extremely important for lung health. Remember, we're not treating disease. We're supporting and promoting the body's ability to have a healthy immune system, and in this case, healthy lungs. And interestingly enough, whenever there's a problem with mucus, excessive mucus production, you want to not even look at honey. So I don't know if you eat honey or put honey in your coffee or honey in your tea.
Well, I just had a cup of tea yesterday with a bunch of honey in it.
Yeah, so that's going to increase mucus production. Go figure, right? So interesting. Sugar would be better here, but when we're attempting to increase immune function, any extra sugar you want to avoid, because too much sugar in the blood depresses the immune system. It depresses immune function. So I would even stay away from orange juice, interestingly enough, when you're dealing with an acute infection. So double the EFAs, take the killer biotics, eat more protein, stay away from sweets and honey. You'll be fine. And for prevention, get the PureWorks foaming cleanser on the hands of the kids.
Thanks,
Appreciate your call, Chris. Keep up the good work. Hour 2 coming up, folks. I'm Dr. Peter Glidden. Remember, keep calm. I'm the doctor. Coming back with Hour 2 after these words.